most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about the best sacroiliac pain relief. It's fast. It's a 3-step self-treatment process here.
That's right, Bob. We're narrowing it down.
And by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. And you're going to want to go to Bob and Brad because this is the last day of this giveaway.
Oh, yes.
Go to Bob and Brad, go to the giveaway section where we're going to be giving away a Sleepovation mattress.
Mm-hmm.
So sign up soon and you can find out who wins.
That's right.
This is just a sample of one, by the way, Brad. This isn't a full one.
Right, and they come with really nice covers.
Yeah, and they're very good for pain relief. If you're having pain when you sleep, you can also, we're also giving away a couple pillows. This is a cross section of one. It's actually got some springs in it. But it feels really soft.
Yeah,
really
you would never know there's springs in it unless you cut it apart and look.
Yeah. All right, the contest will also be on Facebook. It'll be pinned at the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. And someday soon, we're going to have our podcast coming out.
Podcast.
So,
that reminds me of, not Star Wars, that other with Spock in it.
Star Trek.
Star Trek. He's in that little pod. Anyways, that's another story. So, Bob, the sacroiliac joint. Let's get Sam over here. Once again, I always allude to my mother talking about the sacroiliac joint 50 years ago when I was a kid, and I'm pretty sure she didn't know what it was. And I think a lot of people today don't.
They just think it's back pain.
It's a mouthful. And but let's show people what it is. If you look at the pelvis, okay, the pelvis bone is actually 3 bones. It's got the ilium, the ischium, and the pubis bone in the front. And the ilium is actually connected to the sacrum, that solid bone here that's
triangle shape.
Yep, it's the last 5 bones fused together of your spine.
Sure.
And that's where the SI, sacral iliac joint, is right there. There is no fusing of bone between there, at least on a normal person. But there is a joint there, but it's not like your elbow joint. It has a lot of strong ligaments.
A lot of strong ligaments. And it is on both sides, by the way.
Yes, yep. And if that joint has a little bit of motion and it goes out of place where it should, it can create pain.
Especially if it does it on one side, not the other side.
Right, yeah.
No, there's an imbalance there.
Yep. So the whole idea is if you have some SI joint pain that truly is from the SI joint, it may be slightly out, and we need to get some pressure in the right direction to get it to go in, and you'll feel it. It feels better.
Right. And so this is being that you're not therapists and you're trying this on yourself, you don't want to experiment. If it hurts, you don't do it. If it feels better, keep doing it.
Right, and we'll help. We'll
Simple.
talk. Yeah, we'll coach you along in that as we show you. So typically, SI pain, with the exception of if you're pregnant, there's a hormone which is,
I think it's a relaxant.
Right. So the SI joint, the ligaments become a little lax, and you can have that. If that's your case, if you're pregnant, I would not use
I wouldn't
this.
do these.
No,
I would check on other things. You want stability more than movement.
If that's not the case and you think you're having back pain here, sometimes it refers to the knee, but not past the knee, typically with SI joint. Oftentimes it comes from an impact thing, like if you're stepping off of a taller step and you end up landing very aggressively and say, oh boy, that put a jolt through my pelvis or back, that could cause a problem. I've had patients that were in auto accidents where they slide forward and their knees bump into the dashboard. That can create a problem.
The other one I see, Brad, is just people who tend to sit uneven for long periods of time. Now, that's not a abrupt change.
Right.
That's a gradual change.
Right.
I'm that person, Brad. I've had to teach myself because I don't know what it is. When I eat breakfast and lunch, I kind of lean on one side.
It probably revolves from your childhood.
Yeah,
Bob.
I'm sure some childhood trauma, right?
But this kind of a thing, if you some people sit like this for whatever reason, it kind of bothers me. But I've seen people, they're comfortable that way. That could possibly cause it over time. Oftentimes, if your SI joint is painful, the pain makers, the things that irritate it, Number one, it's a weight bearing activity, puts weight through that joint. And
So anytime you're putting weight through
Right.
it, that increases the
right.
pain.
So just standing, if you're one of those people that stand on one leg without even realizing it, and then you go to the other leg and the pain goes away, does that mean it's SI joint? But that's it's pointing that direction. Walking for a distance, that pain hurts, particularly when you put weight on that side. When you sit down,
Stairs.
yeah, up and down stairs can irritate it.
Make it worse.
Typically, when you sit, it feels better, particularly if you're sitting
good
straight and
posture.
even without being awkward, like we mentioned before. So if that fits, and you think, oh boy, I think I've got sacroiliac pain, let's do this system.
Sure.
All right.
I'll make some room here, Brad. You can start off.
Okay, so the first thing we want to do is to relax the muscles in that whole area so that we can get that SI joint back to where it belongs. And I'm going to show you a few options, okay? You can take, where did my tennis ball
Tennis
go?
ball right here. Sorry, Brad.
You can take a tennis ball. This is a little ball, actually. You can get these online. I just happened to be at a store, and it was at the checkout counter. I thought, that's cool. It's got these little bones.
It looks like a medieval.
Yeah. But
ball,
that can be relaxing. So you're not going to do this on your bed. It's probably a carpeted floor. We're going to do it here just so you can see it better.
Got that thing light up.
It lights up.
Uh,
Take it from your child. And you're going to work on that. And either the tennis ball or that. I'm going to use this because it feels better. You're going to roll around on that SI joint and those muscles in that area to loosen up the muscles that are in that area. And wherever, it should feel good.
And that's actually going to loosen up ligaments too.
Sure.
I mean,
yep.
it's.
And I would work both sides. So you're going to do that, not too long, a minute or two. The option I've been using, because I use this for my back, is the back pod. We've promoted this. This is a little costly. I probably would not buy it just for this. If you want to work with your back with it as well as your SI joint, it's a good option. It's made for it. Works very well.
By the way, we have no affiliation with that at all. It's just a therapist we know. He does a good job, and used for costochondritis, actually.
Works great for me.
Yeah.
I have not been to the emergency room with chest pain since I started using it
Awesome.
regularly. Before that, I went 3 times. It was really kind of irritating my life when you think you have a heart attack. And you don't.
Right. Kind of puts a little stress on your life
That's
there.
another video, which we do have some available. So you're going to loosen up the area. Now, what I've just discovered in the last couple months, and I really like this. Now, you may not have one of these either. It's up to you if you want to get one for this, but you can use these massage guns that have become so popular, which we very much like. We actually have one with our name on it, Bob and Brad.
Yeah.
This is a nice gun, works great. I use it on my hamstrings, and I start using it on my SI joint, and I'll demonstrate how I do it. I lay on the floor, and you have to put
He lies on the floor.
okay. You have to put the head on. That's the air cushion one. Because your sacrum and your SI joint, a lot of times it's kind of bony area.
Sure.
If you put one of the harder plastic ones made for muscle, it will not feel good. So put the air cushion head on. You have to have that. And you're going to work it. And I work it a little over the piriformis, the glute. And boy, you can just feel it. Now, I get over the sacrum, where the bony point is, that I don't work that area. But if you do hit it, it does not hurt with that head on. And what I'll do is, to get more pressure so I don't have to work my arm so much, I just trap it between the floor and I just put my body weight into it. And this gun has a lot of power. It has no problem working that. Boy, I could do this for a while, but I'm not going to.
This is always a testimony why it's great when we get a problem. Seriously, because this is something you'd never figure out if you're treating the patient.
Yeah.
I mean, you know right away, you get feedback whether or not this would work.
Exactly.
Now, this is a experiment of one.
Right.
But the good thing about a massage gun, they come in so handy for all sorts of problems. So.
And we've been using massage guns on our patients for a couple of years now with really good results. And
they've come down so much in price. So
exactly.
All right, Brad, next.
So that's phase 1. You get that done. Now, that's the longest part of the whole thing right there. We got to get it loosened up. Actually, if you get out of a bathtub or you get out of a shower in some warm water, if that loosens you up, that can be a good time to go into these next steps as well.
Sure. You want a pillow, by the way?
No, that's okay. I won't be here long. The first thing we're going to do is it's called a muscle energy tech. There's technique. There's two options. Again, you could do this on the bed, but carpeted floor is probably best. If it's your right leg, right side that's hurting, again, while you do this, it should feel good. If it irritates it, you stop. It's not the right technique. Go like this, hold your knee, pull it up here, and then you're going to push the knee that way and do an isometric hold with your arms. And I'm going to push as hard as I can. And while you're doing it, it should feel like good pressure in that SI joint area. And then you relax. You can hold it 6 to 8 seconds and do it 3 times as long as it feels good each time.
Again, if his hands weren't there, the leg would come springing out, basically.
Yep. I'm doing this
He's
motion.
pushing hard.
And I'm locking it with my arms. I've actually had patients do it like this that have longer arms, and that's comfortable. And typically you do the side that, like I have right SI joint pain. This always feels good on my right side. I have tried it on this side. Nothing happens. Not bad nor good. So I just
It is an
leave
experiment because people might have a right anomaly or left, and so it's always hard to say. But one tends to be more common.
You work with it, you'll learn your body.
Right.
Okay.
Right.
The next thing is you can take a stick. We're going to use a Booyah stick. You can use a cane. You can use a broomstick. You put it between your knees, and then this leg is going to push that way.
Yeah.
This leg is going to push that way. And if I didn't hold it, it would go like this.
Sure.
But I'm going to hold this. And this is it's another muscle energy technique, just a different way to go around it. Same thing, hold it 6 to 8 seconds and do it 3 times as long as it feels good on that joint. You'll know.
And you could alternately try this way.
Yep.
So you're going to push down with the left one,
Yep.
this one, and you're pushing up with that one.
Right.
So
This is really fun to work with patients because when they do it, and it's like, oh, that feels good. And they say, why didn't I figure that out on my own? It's because, well, we're the therapists.
It's
You can't figure it
difficult
out.
one. Then I want to finish up with the little squeeze together. Brad.
Oh, good point,
Yeah.
Bob. And this is something more for the pubic joint, but it can work on the outside. Very simple. There's one of those things that it can help. You're going to put your fist between. You can put 2 fists there, 1 fist, and just squeeze, another isometric squeeze, and hold that 6 to 8 seconds, and then
You're
you're
done. Just finish with that.
Yep.
Just each time you do one of the muscle energy techniques.
Now,
And Brad's final.
this is the one I use commonly. I don't even have to warm up or loosen it up, although it helps. I'll do this before I run, and I'll get up on a tall stool or something outside. There's a ledge right outside my door before I go running, and we're doing the same thing here. It's not a muscle energy technique, but it helps rotate that.
Innominate ball.
Yeah, exactly. You know what innominate stands for?
What does it stand
It's
for?
a Latin term. It stands for no name.
Oh, funny.
Yeah, there's no name. They
couldn't come up with a name.
I
for it,
looked
so-
that up one late night in anatomy, studying anatomy when I was in college, and I always liked to know the Latin names. And I'll do this, hold it for, again, 5 seconds or so and do it 2 or 3 times.
And again, it might feel better to put the other leg up, but we don't know
Yep.
on you.
Now, I just know personally, if I go for a walk back, it doesn't matter as much more since I've got this figured out. I would just do this, and the pain would go from a 3 or a 4, drop it down to 0. It's like
Wow.
clockwork. So that's the response you had. If it makes it worse, you stop. Or if it's not any better, you can play with it some more.
I'm trying to think what else you should get, Brad. What malady you should get to be able to help people out there.
Melody.
Well, like a problem. Like, let's say
Oh.
maybe you should tear your ACL so we can.
Yeah. Don't say that,
Yeah,
Bob. My
sorry
gosh.
about that.
Well, we got Chris. He's done an ACL, so we'll
Oh,
get
there
him.
we go. Thanks for watching, folks.